Welcome to Pharm Fridays. Today's star, Metoprolol, a beta blocker you'll see everywhere in nursing. It's the go-to for conditions where the heart's working too hard. Think high blood pressure, chest pain, or fast irregular heartbeats. Imagine the heart as an engine revving too high. Metoprolol eases off the gas, letting it relax and work more efficiently. It lowers heart rate, reduces contraction force, and brings down blood pressure, giving the heart a break. You'll see it after heart attacks, for tachycardia, and to steady irregular rhythms. Metoprolol comes in two forms: tartrate, short-acting, usually twice daily, and succinate, long-acting, once daily. Knowing why it's prescribed is your first step to mastering its use. It's not just about giving a pill, it's about making a real difference for your patient's heart. Watch for Metoprolol on your patient's charts during clinicals. By the end of this video, you'll feel confident handling this essential med. Let's break down how Metoprolol works. It's a selective beta blocker, mainly targeting beta-1 receptors in the heart. Normally, adrenaline tells the heart to speed up and pump harder. Metoprolol blocks that message. Think of it as a bouncer at Club Heart, keeping adrenaline from starting a wild party. The result? The heart beats slower and less forcefully, lowering blood pressure. This is especially helpful for patients with hypertension or fast, irregular rhythms like atrial fibrillation. By slowing chaotic electrical signals, Metoprolol helps the heart beat more regularly and efficiently. Less strain means better long-term heart health. It's a simple block with a powerful effect. That's why it's a staple for so many cardiac patients. Remember, calm heart, calm body. Before giving Metoprolol, assessment is key. Always check heart rate and blood pressure. If either is too low, hold the dose. Most hospitals hold if heart rate is under 60 or systolic blood pressure is under 90 to 100, but always follow your facility's policy. Ask your patient if they feel dizzy, lightheaded, or unusually tired. These are red flags. Orthostatic hypotension, feeling woozy when standing, can be worsened by Metoprolol. Document your findings and reasons for holding the med, if needed. After giving it, keep monitoring for drops in BP or heart rate and new symptoms. Good nursing means constant assessment and re-evaluation. Mastering this checklist keeps your patients safe. That's what separates a good nurse from a great one. Let's make side effects easy. Remember the 3 B's of beta blockers. First, B, bradycardia. Metoprolol can slow the heart too much. Teach patients to check their pulse and report dizziness or fainting. Second B, blood pressure. Watch for hypotension. Instruct patients to rise slowly to prevent falls. Third, B, breathing problems. At higher doses, Metoprolol can affect the lungs, causing wheezing, especially in asthma or COPD patients. Always check for a history of respiratory disease before giving. Monitoring. Heart rate, BP, and breathing is your safety net. Patient education is crucial. Teach them what to watch for and when to call their provider. These 3 B's help you remember the most important risks. Quick recap: bradycardia, blood pressure, breathing. Keep these in mind for safe administration. Simple, memorable, and effective. That's how you ace your exams and protect your patients. Here's a golden rule. Never stop Metoprolol suddenly. Stopping abruptly can cause rebound hypertension or tachycardia, dangerous spikes in heart rate and blood pressure. The body may have made extra beta receptors while on the drug. Suddenly stopping means adrenaline floods in, overstimulating the heart. This can trigger chest pain, heart attacks, or worse, especially in cardiac patients. Always educate patients. Don't run out or quit Metoprolol on their own. If they need to stop, their provider will taper the dose slowly to prevent rebound effects. Patient education here is life-saving. Make sure they know to call their provider before making any changes. Tapering allows the body to adjust safely. Empower your patients to be partners in their care. That's nursing at its best. Pop quiz. Can metoprolol treat both high blood pressure and fast heartbeats? Absolutely. It's a multi-talented heart superhero. Slows the heart, lowers BP, and controls rhythm. One pill, double benefit. That's why it's a favorite in cardiac care. So remember, metoprolol helps the heart chill out, but you've got to keep an eye on that pulse. If you enjoyed today's Pharm Friday, give this video a thumbs up, share it with a classmate, and subscribe to Clinically Curious, where we fuel knowledge one concept at a time. Be sure to check out the PowerPoint link in the comment section for more information on metoprolol. See you next Friday.